Having secured support from the states for its health reforms, the Gillard government is vowing to fix the aged care crisis. Industry figures say homes for the elderly are in desperate need of a funding boost.
Aged care resident Patricia Cunn fears for the future of a system she says runs on a shoestring.
A lot of pious words are not going to do it. It does take more money.
Industry leaders gathering to highlight a cash and workload crisis in homes where workers can earn up to $200 a week less than counterparts in other areas of the health system.
It's become a really critical, intensive industry to work in, and we need a good and safe skill mix of nurses and carers.
The funding that comes from government doesn't actually enable providers to pay the wages that need to be paid. Our providers want to do that. Aged care providers value their workforce highly.
And the Minister for Ageing, Mark Butler, agrees the industry needs a lifeline.
We know that it's a sector that is struggling. We know that it is a sector that is largely built on structures put together in the mid-1980s.
It's the next challenge for federal Labor, under fire for not doing enough for the elderly and the mentally ill in its hospitals plan.
We needed to deal with the financing of the health system, the key components of primary care and hospital care, before we dealt with some of the other areas that still need more work.
And the Premier has returned from Canberra defending the decision to sign Victoria up to the National Health Deal, even though much of the detail is still to be finalised.
The devil is always in the detail, and that's exactly what the states were very keen to respond to.
Gareth Boreham, 10 News.